There is a good chance you or someone you know is touched by breast cancer. In fact, the CDC says it is the second most common cancer among women in the United States. Treatment can be an exhausting and long road. Now, a new study by UPMC Hillman researchers says not all breast cancer needs to be treated. Good evening and thank you for joining us tonight at 7:30. I'm Megan Schiller. This study could mean big changes in how oncologists treat early breast cancer in older women. And joining me now live over Zoom to dive deeper into the study is UPMC Hillman Cancer Center researcher Dr. Adrienne Lee. Dr. Lee, thank you for joining me tonight.
Thanks, Megan, for having me tonight.
Can we begin by talking about what age group of women did this latest research focus on?
Yeah, so we're focusing on breast cancer in the elderly, as you said. So about a quarter to a third of all breast cancers occur in the over 70-year-olds. So we're specifically focused to try and understand that type of disease.
What makes the treatment of older women with breast cancer different than younger women?
So they often have other comorbidities. They may have issues with diabetes, heart disease, and other features. And so physicians have to take that into consideration when they think about their breast cancer care.
What are the side effects of treatment that could cause, as what researchers say, more harm in older patients?
Yeah, so we're often thinking about giving the right therapy to the right patient at the right time, this idea of precision medicine. And some of these therapies do have associated toxicities. Radiation therapy, for example, has known toxicities. And if we can only give that to the patients who require it, this would be important for those ones that don't require it.
I was interested because the research said that treatment doesn't always improve recurrence or survival rates. Why is that?
Yeah, so in this population we looked at specifically, over 70-year-olds with estrogen receptor positive, low stage cancer, the chances of that recurring are quite rare. And so we can think about reducing some of the therapies for this less aggressive type of disease.
What are the positives of not treating someone with breast cancer?
So I think that we're at that point of more is not always better. But sometimes we want to actually give less. This is quite hard for patients to understand, but you don't always want to give more. If the odds of it recurring are so small and you can't change that with therapy, then not having that therapy reduces those unwanted toxicities and unnecessary toxicities. And so hopefully those patients can have better outcomes.
And better quality of life.
Exactly.
If you decide to not undergo treatment, what happens to you? Are there other options or do you just go home?
So they get standard of care. We're talking about extra types of treatment. So they're going to get surgery. They're going to get several types of other therapies. It's these other therapies like sentinel lymph node biopsy and radiation therapy that we're saying these can be safely omitted. We are continually looking for more types of treatment. So we specifically study this age group to see if we can find new therapies. And that's what research has done for us. We've learned an incredible amount about breast cancer. We've improved outcomes, and we're specifically drilling down into these populations to try and personalize their care.
Do you think this is something of the future? With people living longer, we'll see more women getting cancer when they're older?
Certainly, the numbers suggest that. Clearly, breast cancer, that age group we study, the 70 to 84-year-olds, that's the largest growing number of breast cancers as we grow older. And that's why we need to target research to that group.
And is this the first of its kind when it comes to a discovery like this?
This actually is now quite an active area, trying to de-escalate therapy for those that don't require it. This idea of giving the right therapy to the right patient. I think breast cancer is the leading cancer for doing that. And I think what we are seeing from our data at the UPMC Hillman Cancer Center, when you use this large electronic health record data, we can understand who we've treated and help that to learn from it and improve treatments for the next population.
The more treatment, the better. Dr. Lee, thank you so much for offering your expertise tonight and all this information. We appreciate it.
You're welcome. Thank you for having me.